Hi, I'm Angie Forsyth, a physical therapist specializing in people with hemophilia and people with hemophilia and inhibitors. What makes physical therapy different in people with hemophilia and hemophilia with inhibitors? That's the question we're going to answer in this session. As healthcare providers, we always like to provide the interventions that meet our patients' specific needs. We can't always presume that our interventions offered to the general population would be safe and effective in someone with hemophilia or hemophilia with inhibitors. So today we'll go over 10 helpful tips for physicians, physical therapists, and other healthcare providers that will help us meet the needs of patients with hemophilia and hemophilia with inhibitors. Comprehensive care is the standard of care in people with hemophilia. According to the National Hemophilia Foundation in the United States and the World Federation of Hemophilia, having a physical therapist is part of the core treatment team. There have been many studies to show the benefits of comprehensive care in our patients. Anything from increased employment levels to decreased cost of care, even to reducing mortality has been shown, but these are just statistics. Ask any patient about the value of having a physical therapist on their team. They learn more about how to participate in everyday activities, how to prevent and treat bleeds, as well as rehabilitation after an orthopedic procedure. We have the benefit of practicing in the developed world, where the factor first recommendations can be more easily followed. The standard of care is that our patients infuse factor within 2 hours of noticing symptoms of a joint bleed. But it's not all about the factor. Working with the physical therapist is essential in the healing process. Not only do we do the traditional work of rehabilitation after an injury, but we also work toward prevention of future bleeds in our patients. It's very important that we're proactive in our care and try to prevent future bleeding, try to preserve a patient's joint health, rather than just being reactive with medication following a bleed. It's not automatic that our patients will return to their baseline status either after a bleed, so working with the physical therapist is very important in achieving this goal. What happens when blood goes into the joint? While we have a normal anatomy that we expect in each joint, we expect that the ends of the bones will be cushioned by articular cartilage that is healthy. We expect that there's a synovial fluid within that intra-articular space that has its jobs of nourishing the cartilage and helping that joint to move smoothly. What happens when blood enters this space? Well, blood is an irritant. It sets forth a process that is going to eventually damage both the synovial membrane as well as the articular cartilage. Over time, the synovial membrane, with repeated bleeds, can become hypertrophied. This means that there are finger-like projections that can project into the intra-articular space, and they also have a greater number of capillaries. This means that normal everyday movement can pinch these capillaries in the synovial membrane and cause more bleeding. This is a process that we would like to prevent. We want to prevent chronic synovitis from occurring. In addition to the synovitis that can occur from bleeding, the articular cartilage can also become damaged over time. No longer is there healthy cushioning of those bones in the joint space, but little divots and injury appears to the cartilage, which over time wears away. As you can imagine, this leads to arthropathy in our patients, which is a very painful condition. The patient interview is a very important part of the physical therapy assessment, listening to our patients. It sounds really simple, but listening to our patients and the parents of our patients in the case of small children is very important. Here's where we could find the details about the patient's everyday life. things that they're doing during their normal activities of daily living, sports or exercise participation. These are where we find the clues that might help us to prevent future bleeds. If there's an acute problem, the physical therapist also listens in the interview to talk to the patient about these activities. What things in everyday life might be leading to joint bleeds? This is something very important to figure out so we can prevent future bleeding. We'd like to welcome Sean to our clinic today. Sean is a 9-year-old boy without hemophilia, so he's going to demonstrate for us normal anatomy. It's very important to understand the normal anatomy and then be able to pick up small, subtle changes that might occur in our hemophilia patients. The physical exam actually is very important to combine with the thorough subjective history. Through the physical exam, we're able to pick up small, subtle changes in the joints and track this information over time so we can have a more successful intervention as physical therapists. Now, physical therapists use a wide range of objective measures in clinic, and these measures can even be placed into a validated tool, such as the Hemophilia Joint Health Score. One element that this score evaluates is swelling. So with Sean, if we take a look at his 2 knees and compare the knees side to side, we want to make sure that we could see easily the bony landmarks that are present in the knees. So we're looking at the landmarks around the patella, we're looking at the landmarks of the joint line of each knee. We're feeling for any palpable puffiness or fullness around that joint, and Sean has normal knees. There is no swelling present. Another element we could look at would be joint range of motion. So if we take a look at the range of motion of Sean's knees, and the therapist is gently bending and straightening the knee and the patient back and forth, we're taking a look at the full range of motion into flexion, but also the full range of motion into straightening or extension. It's very important that we pay attention to extension, especially in our patients with hemophilia. After some repeated bleeds, sometimes gaining full extension back becomes a challenge, and we want to pick up a small, subtle change as soon as possible so we can direct our interventions toward achieving this full range of motion. We're also listening to the joint with our hands as we assess the range of motion. We're palpating for any crunchiness or any crepitus that we feel in the joint during this motion. And with Sean, this is a normal range of motion. The physical therapist is the musculoskeletal joint expert in hemophilia clinic. We're trained to recognize very small, minor, subtle changes in the function of joints, from biomechanics to swelling to strength to walking. Anyone can look at a patient's joint that's very swollen and where the patient isn't using the joint and notice that there's a problem. However, it's difficult to intervene and return that joint to a healthy state at this point. That's why it's very important for your physical therapist to examine the patient, notice these small, minor, subtle changes, and we have a better ability then to intervene with physical therapy to return the joint to a healthier state. In today's society, with our busy lives, it's easy to look for the quick fix. It's easy to take the patch me up coach and put me back into the game mentality, especially practicing in our country where our patients have immediate access to medication. There's great treatment in terms of factor replacement or the use of bypassing agents, as well as pain control. So this, in effect, can allow our patients to take a shorter rest period because they feel okay and they go back to their everyday activity. But is this really the correct approach? In my experience, I like to teach patients by using this analogy. If you think of your kitchen sink, that the faucet is running, the water is on, the sink is clogged. That sink just keeps filling up with water. If you compare this to a joint bleed, you turn off the water, so to speak, by adding factor infusion. But does that drain magically let loose? Does the water come out? Does the water leak out? No. It's the same with a joint bleed. You give factor, The bleeding from the synovial membrane ceases, but that blood continues to be part of the interarticular space. It continues to be an irritant within that joint, and it stays there up until 2 weeks before it's resorbed, according to expert opinion. Following an acute joint bleed, there's a right place and a right time to add activity back into the patient's everyday life. If we follow the basic biology principles, we know that we can affect tendon, muscle, and bone with controlled loading, with weight bearing, with exercise. But too much too soon could lead to detrimental effects rather than the positive ones we're wishing to achieve. Can elective orthopedic surgery be performed in a patient with hemophilia or a patient with hemophilia and inhibitors? The answer is yes, but it's definitely a team effort and definitely helps if the physical therapist has specialized information about working with patients with hemophilia or hemophilia with inhibitors. If we take total knee arthroplasty as an example, any typical physical therapist working in the hospital has generally treated a patient after a total knee replacement. Typically, our goals in this situation are achieving 90 degrees of knee flexion before discharge from the hospital. The hospital stay is very short, between 1 and 3 days. Oftentimes, we are performing aggressive range of motion to meet this goal, and the patient may also be in a CPM or continuous passive motion machine up to 23 hours per day. But if you look at this operation in someone who has hemophilia or hemophilia with inhibitors, the physical therapist should be much more conservative in their approach. Oftentimes, we sacrifice gains in range of motion for meeting the primary goal of prevention of bleeding and promotion of the healing process. So we're much more conservative in our approach in these patients. There are typical physical therapy interventions that are used in general practice. Things like stretching or manual techniques or using a bag of ice following exercise. But what we need to think about are there risks and benefits to using these same interventions in our patients with hemophilia or hemophilia with inhibitors? For example, we might think that aggressive stretching is not such a good idea in hemophilia patients, and this is true. However, using ice as an example, would you think that a simple bag of ice could pose a problem in patients with hemophilia or hemophilia with inhibitors? In fact, if you look into the research, local cooling has an effect on coagulation. Is this something we want to be using with our patients with hemophilia or hemophilia with inhibitors? We always need to keep in mind that our primary goals with these patients are prevention of bleeding as well as promotion of healing. The primary goal of working with patients with hemophilia and hemophilia with inhibitors as a physical therapist is to prevent bleeding and promote healing. Every intervention we apply, every piece of advice we give needs to be tempered with the fact that we don't want to cause a joint bleed with any of our recommendations. In addition, every time we see the patient during every intervention, we always want to make sure to monitor very closely for any signs of bleeding or synovitis. There's no recipe for physical therapy in treating someone with hemophilia or hemophilia with inhibitors. We are always keeping in mind offering the best treatments to our patients without causing a bleed. We want to provide the best services that we can as physical therapists to our patients with hemophilia and hemophilia with inhibitors. Having a specialized, trained physical therapist on your hemophilia treatment center team is very important. But we all know that we don't start out knowing everything about hemophilia or hemophilia with inhibitors. That's why it is very important to reach out to different networks, such as the physical therapist with the National Hemophilia Foundation in the United States, or to centers like the Blood CME Center, where you could receive specialized training about physical therapy and hemophilia right on the web. It's key that we provide the best services we can by combining our specialized training in physical therapy with our basic knowledge about hemophilia.